I would now like to call upon Ms. Swati Saxena, the India Head Growth and Strategy Arogya World. Please welcome her with a big round of applause.
Can you cue my presentation, please? Okay, so good afternoon, everyone. I am just very happy कि मुझे post-lunch session मिला. So we had, food for the body, then food for the mind, and food for the soul, and now we are all ready. So thank you so much. मेरे को सोशल सेक्टर में काम करते हुए 17 साल से ऊपर हो गए एंड आई रिमेंबर जब मैंने काम करना स्टार्ट किया था वन ऑफ द थिंग्स दैट यूज्ड टू रियली बॉदर मी वाज दैट वी यूज्ड टू ऑलवेज वर्क इन साइलोज सब लोग अपना अलग अलग काम कर रहे हैं कभी कोलैबोरेशन या इकट्ठा काम करने का बहुत कम मौका मिलता था आई थिंक तब इतना प्रयास भी नहीं करते थे टेक्नोलॉजी भी नहीं होती थी एंड इंक्रीजिंगली आई फील दैट सिंस so many things have changed. Technology has come in. Telecom has been an enabler. I feel like there is so much of interest in finding out what others are doing, and there is a truly collaborative approach that's taking place in this sector. So I'm very, very proud that we are working in this sector at this time when something like this is happening. I think that's something that we should continue and make stronger. So about me, the organization that I head right now, it's called Arogya World. I am the India head for the organization. Arogya World is an organization that works on chronic diseases or non-communicable diseases, which essentially means diabetes, heart health, mental stress, mental wellness, etc. आप next कर देंगे? Okay. सो दिस इज़ समथिंग हम लोग सुबह से बात करें एजुकेशन की बात करें लाइवलीहुड की बात करें एंड आई थिंक अ कॉर्नर स्टोन ऑफ ऑल द वर्क दैट वी डू इज़ हेल्थ एंड इट इज़ the absence of disease where you are saying that you are absolutely fit and physically well. And globally, we know that unhealthy eating is the #1 cause of ill health. And in India for the current scenario is going through what we call an epidemiological shift. कुछ साल पहले तक हम लोग के यहाँ पे maternal health, neonatal mortality, morbidity से deaths बहुत ज़्यादा होती थी. There's a lot of work that has happened because of which there is a positive trend where that number is coming down. But the stark opposite of that is happening in non-communicable diseases, where the trend is going in the reverse direction, where currently if you see, there's 63% of the death burden in India is because of NCDs. And we know that the onset of diseases like diabetes in India happens much earlier as compared to Western countries. And during COVID, we have all experienced it. It was a very unfortunate situation when we saw that people that we loved and we knew if they had a comorbidity like diabetes, they were so much more vulnerable and at risk. And that is what we want to control. And this problem is not just a health problem, but it is also very, very important from an economic perspective. So there's a study that shows that almost $4.58 trillion is what India stands to lose because of non-communicable disease burden. And if we want to work towards that, that's very, very important to make sure that we're able to address this issue. And again, I am referring back to COVID क्योंकि उसमें हमने देखा था कि जो लोग को disease है और जो लोग अंडर प्रिविलेज्ड हैं अंडर सर्व्ड हैं उनके लिए डिजीज़ बर्डन एंड उसके कॉन्सिक्वेंसेस बहुत ज़्यादा थे सो अगेन इफ़ यू आर कमिंग फ्रॉम अ पुअर फैमिली एंड समबडी इन द फैमिली हैज़ डायबिटीज़ अप टू 25% ऑफ द इनकम ऑफ द फैमिली इज स्पेंट इन दैट ट्रीटमेंट एंड मैनेजमेंट विच इज़ समथिंग दैट pushes the family deeper into poverty and that is what we want to change. Next कर दीजिए. ये एक स्पेसिफिक स्टैटिस्टिक है महाराष्ट्र का हम लोग अभी आज़ादी का अमृत महोत्सव मना रहे हैं 75 ईयर्स ऑफ इंडियन इंडिपेंडेंस एंड एक बहुत छोटा सा न्यूज़पेपर आर्टिकल आया था कुछ महीने पहले जिसमें कि द स्टेट हेल्थ डिपार्टमेंट डिड NCD स्क्रीनिंग ऑन अ मासिव लेवल इन महाराष्ट्र एंड महाराष्ट्र कुछ उन स्टेट्स में है जहाँ पे काम बहुत अच्छे से हो रहा है स्क्रीनिंग का तो वन डेटा दैट केम आउट कि 1.5 महीने की स्क्रीनिंग एंड 4 डिस्ट्रिक्ट्स में 1 लाख पीपल वर डायग्नोज्ड for diabetes and hypertension. 35,000 for diabetes, 75,000 for hypertension. The idea behind this is that it is just the tip of the iceberg. The problem is so deep that you can just see that within a small period of time, This is the kind of statistics that came out. And this is, again, something that's very important for us to address. We know these problems, right? And सुबह से a lot of speakers have talked about it कि लोग शहर की तरफ आ रहे हैं, गांव छोड़ के आ रहे हैं, urbanization का problem है, modern lifestyle का problem है, big food. It is cheaper to eat junk food as compared to eating healthy. There is an issue. अगर आप गरीब है तो आपको time poverty है. You don't have time to cook, so it is just so much easier to eat something which is a junk food, which adds to the problem. And then, of course, हम लोग का जो health system है, अभी भी it is catering towards treatment. It is not focusing as much on primary care, preventive care, जहाँ पे ये actually problem आप address कर सकते हैं. And then finally, हम लोग का जो workplace culture है, जो health system है, it is not really geared to promote wellness, whether it is physical wellness or mental wellness. And ये सब से, it is one of the reasons, these are actually the key reasons जहाँ पे India is facing this problem. And what is the solution? Now, this is so simple that if you look at this slide, it's clearly telling you, if you just do 3 things, if you eat healthy, if you exercise, and if you avoid tobacco, you can avoid up to 80% type 2 diabetes, up to 80% heart diseases, and up to 40% cancers. And that is exactly the area of focus for Arogya World. This is where we want to focus all our energies. And we are one of the few organizations in India, we only work in non-communicable diseases. That's our core area of focus. And we have put all our resources, all our energy behind addressing this problem in India. So what is our approach? Essentially, we want to build a healthy lifestyle movement. We want to put people in the center of this whole dialogue of changing the ecosystem, where they can be more responsible themselves and they are supported to be more responsible, and society as a whole has to change. And we believe in a very collaborative, multiple stakeholder approach, because we feel that there is already a lot of work happening in India on this. There's a lot of focus gradually that I see that's happening on NCDs. So we want to work with partners, we want to work with collaborators, so that together we can make much more of an impact. And we also want to integrate our work with the government's Ayushman Bharat health and wellness centers, which are getting, they're offering comprehensive primary care, which is focused on wellness and health at the village level rather than just treatment. And then, of course, we also want to focus on training of frontline health workers. So essentially, we want to make prevention accessible. We want to work in a way कि हम लोग prevention स्कूल तक लेके जाएं, जहाँ पे बच्चे लर्न कर रहे हैं, ऑफिसेस तक लेके जाएं, जहाँ पे लोग काम कर रहे हैं. एंड ऑफिसेस से मेरा मतलब कॉर्पोरेट ऑफिसेस नहीं है. ऑफिसेस मीन्स MSMEs, ऑफिसेस मीन्स स्टार्टअप्स, ऑफिसेस मीन्स फैक्ट्री फ्लोर तक हम लोग अपने ये प्रोग्राम्स लेके जाएं. उन लेवल तक वी वांट टू रीच. And then we want to work in the communities where people live. So that's our approach. Where people live, where people learn and people work, we want to take all our programs there so that we can make an impact. And our programs are all evidence-based, they're scientific. We use technology, we use telecom a lot, so our programs are highly scalable, they're highly cost-effective, and all of that makes our programs extremely sustainable. So I just wanted to show you quickly glimpses of the work that we do, right? Because we are working in the space of prevention and we are working in the space of behavior change communication, which is extremely difficult, right? Because I think I heard a few comments that, how do you show that tangible impact that you're creating through that? And that's very important. And this is one critical piece when you talk about prevention. Behavior change and information is very, very important. And अगर we look at the government's आयुष्मान भारत स्कूल करिकुलम, वो भी यही बात करता है कि आपको डायबिटीज़ की बात एडोलेसेंट बच्चों के साथ करनी चाहिए. जब तक वो बड़े होते हैं तब तक दे ऑलरेडी इंट्रैप्ड. उससे पहले आपको वो बिहेवियर चेंज करना चाहिए, उससे पहले कि उनके लाइफस्टाइल हैबिट्स सेट हो जाएं. तो हम लोग का एक प्रोग्राम है हेल्दी स्कूल्स. उसमें हम लोग ने बहुत पार्टिसिपेटिव एक्टिविटीज़ के थ्रू वी रीच टू किड्स, वी मेक देम पीयर लीडर्स एंड वी टॉक अबाउट बिल्डिंग दीज हेल्दी हैबिट्स. वो खुद के लिए भी करें एंड वो अपनी फैमिलीज़, अपने कम्युनिटी में भी ले जाके ये बात करें. वी हैव रीच मोर देन 5 लाख स्टूडेंट्स एंड वी हैव द प्रोग्राम इन 9 languages and 12 states. And we also believe in impact measurement. So we have data that shows more than 15% impact, whether it is knowledge, whether it's attitude, yeah, actual practice level. So the actual change that you see in habits of the child. And this program is also digitized. This program is also available online. So it is a very accessible program. अगर हम लोग गाँव में, विलेज में काम कर रहे हैं तो हम लोग फिजिकल मॉडल में करेंगे जहाँ पे इंटरनेट नहीं है. जहाँ पे अगर लो बैंडविड्थ का है तो हम उस मॉडल पे काम करेंगे. जहाँ पे हाईली डिजिटाइज्ड है, अर्बन स्कूल्स है, जहाँ का इंफ्रास्ट्रक्चर बेटर है गवर्नमेंट स्कूल्स का, तो हम लोग उधर पे वैसे काम कर सकते हैं. सो इट्स अ वेरी वेरी adaptable model that we have created. That's why we have been able to reach in 12 states. This is the second program I wanted to talk about. So this is mobile diabetes. ये absolutely एक technology and mobile health leverage करता है ये program. The idea behind this program is that, and this is based on the research that WHO has done, कि आपको healthy eating, exercise and avoidance of tobacco, इन तीनों चीज़ों पे काम करना है. So हमने अब multiple experts के साथ काम करके we have created 56 messages. They are available in 12 languages. And what we do is, if you see the graph, we talk about medical science, we talk about things like high blood sugar से क्या problem हो सकती है, diabetes के क्या impact हो सकते हैं आपके ऊपर. We talk about the importance of fitness, आप physical activity कैसे increase कर सकते हैं. We talk about diet also, कि आप छोटे छोटे changes daily life में करके भी उसका impact कर सकते हैं. And then we talk about lifestyle changes. And if you see, आजकल at least I have been coming across a lot of programs जहाँ पे वो diabetes prevention की बात करते हैं, diabetes reversal की बात करते हैं, diabetes management की बात करते हैं. But it is all very expensive. It is not meant for people who have affordability issues. So this program is taking this in the local language, in the context, to everybody who wants access to it, and to make it very, very easy to understand and follow. We again have seen almost 20% impact in behavior change, in practice, and we have also seen, जब ये हमने प्रोग्राम के बाद 3 महीने बाद स्टिकीनेस स्टडी की थी तो हमने ये भी देखा कि लोग उसको फॉलो कर रहे थे. सो देयर इज़ अडेयरेंस टू द एडवाइस गिवन. एंड करंटली स्टैनफोर्ड का एक सेंटर फॉर हेल्थ रिसर्च, एजुकेशन, हेल्थ रिसर्च एंड एजुकेशन है, वो इस प्रोग्राम का थर्ड पार्टी असेसमेंट भी कर रहे हैं, एंड द इनिशियल रिजल्ट्स आर पॉजिटिव. And finally, this is what it is, more than 77 million Indians live with diabetes, and that's something we cannot live with, because we feel that unless it is controlled, unless it is addressed, this problem is going to get worse, and you cannot treat yourself out of it. And I would like to take this opportunity, because we've got multiple people from multiple groups, to say that Arogya World as an organization, we don't have an IP over our content. We are more than happy to share our content. We are more than happy to collaborate. If you feel there's any way we can add to your work, if you feel you can adapt our programs and use them in the work you are currently doing, we are more than happy to have a conversation around it, and we can see how we can make it work. Our idea is that we want to take our programs to the maximum number of people, because we know it works, we know it's a simple solution, and we know it's a very powerful solution for a very large problem already, and that has the potential to become a much more difficult problem. Next slide. That's it. So that's my email ID. Please feel free to reach out to me. Thank you so much.